Hi, I hope you're well. I'm Andrew Dean, Director at Menlo Park. This is the Illuminating Health Tech podcast, and we're regularly approached by GPs interested in pursuing a career within health tech. I'm joined today by Dr. Tom Micklewright, so thanks very much for joining us, Tom, who's been working within the health tech sphere for the last 5 years. Tom's had a very interesting career journey to date, so his insights and advice are going to be indispensable to those within our network looking to pursue a career in tech, as well as tech companies who are perhaps considering how a clinician could add value to their team. Tom, when you look at your CV, you didn't follow a traditional route into general practice. You've engaged with lots of different groups and organisations during your medical training. And you even developed a mental health social enterprise for disadvantaged children, which is obviously impressive while studying at the same time. You quite clearly have an entrepreneurial spirit. So what prompted you to pursue a career in medicine? And did you know that you'd be doing all of these things, at the same time whilst doing so?
I definitely had no idea things were going to turn out the way that they did. I think it's Steve Jobs in his Stanford commencement address. He reflects on the fact that when you look back at your career, you can find it relatively easy to join the dots. But when you're progressing forward, it's almost impossible to see how all of these things add up to the whole. And I mean, my career is still developing, but already I can see that all those random little bits that I did on the side are starting to add up to something. So my journey into medicine was the same as many of your listeners will have experienced. I think anyone who's got a bit of a scientific leaning when they're at college and secondary school, and does quite well with their grades and their exams, kind of gets channeled towards medicine as a potential career option. But as well, I really wanted to help someone. I wanted a job that I feel proud about, that I could go and tell my parents, this is what I've done, this is how I've helped. So that's kind of how I ended up going into medical school. But while I was there, I can remember this feeling that actually, although I love the science and I love the big picture thinking around medicine, actually my time on the wards wasn't the most fulfilling.
Mm-hmm.
I really had this sense I wanted to do something a little bit more creative. I wanted to build, I wanted to explore new ways of doing things. And a lot of my conversations with career advisors would be, just get through med school, then just get through F1, then just get through F2. And eventually it was somebody who said, it was a career advisor pretty far into my uni days, who said to me, Tom, I think your problem is you're looking for something entrepreneurial. And I hadn't really come across the word before. Mm-hmm. And he said, if you want an entrepreneurial career in medicine, look at public health, psychiatry, or general practice, and that'll give you the most scope to build the kind of career you want. So that was my route into general practice, really. It was the desire to be autonomous and to really try and shape the way things are done in practice.
Yeah, because that was going to be a question as well. Choosing general practice. It's one of those decisions that you obviously have to make part way through your training, which way you're going to go. But yours was actually steered by some career advice saying, well, actually, if you want to pursue these different routes, general practice is going to allow you to do that essentially.
That's absolutely right. And once I started doing general practice training, you quickly get exposed to GPs that are doing some fantastic things. Some of them are. Some of them have gone into partnership or full-time salary general practice, which is a hard job in itself. It's a fantastic career. But others also I came across were working in prisons or drug and alcohol services or cruise ships or sports teams. There just seems so much scope. I thought, actually, I can probably really find not only a niche, but a way of building a bit of a portfolio career where I'm trying lots of different things out. Because even at that point, I don't think I'd really found the thing that felt perfect for me. I just didn't want to close any doors.
Yeah, absolutely. No, I think that's really interesting because I've not, heard that reason for pursuing general practice before. So it'd be interesting to see, if that resonates with, anyone, any of our listeners, anyone within our demographic, and particularly now whether it is advice GPs are receiving as they go through the system these days because of the opportunities within health tech. Because I think historically it's certainly something they haven't had advice on, and I think it sounds like you probably had a good careers advisor at the time, which isn't always the case, is it?
Definitely not. I was very lucky to have the conversations that I had. And I think now as well for GPs, there are probably even more opportunities open to us than when I was a trainee. When I was training, telemedicine wasn't really a thing. And now, GPs can practice anywhere in the world potentially and just consult by video. So it's just, general practice really is a world where there is so much that you can do. So much scope for practice that's beyond the imagination of a lot of the other traditional specialties in medicine.
Absolutely. I think, one of the things I picked up on as well was, your advisor said that you're not going to get much, fulfillment from that. But I think, one of the things is, you go through that training, like, sometimes you feel that you do, you owe it to people, you want to make people, proud, or you think, well, I've gone through all that, so actually now I need to go and practice as a GP. And I've got bills to pay, so I need to go and do that, on a full-time basis. But I think what general practice, perhaps allows you to do is maybe to buy yourself some time to, perhaps do some sessions here, some sessions there, but then actually pursue some of those things that are going to, make you happy or fulfilled at work, because we don't know what it's going to be like until we do it. And who, and still by the time you've gone through your medical and your GP training, you don't know what you want in life. There are still going to be, things you need to kind of experience in order to think, actually, that would be, really interesting, or, something that I want to do going forwards. So I think that's a really good point. So how has general practice shaped you as a medical leader, would you say? What tools has it given you to do the job that you do?
I think general practice gives you an amazing ability to see the whole, and that probably sounds a little bit cliche, but it really does. It shapes your approach to risk. In general practice, you never have all of the answers, and I'm not saying that you do in secondary care, but in secondary care, the availability and access to tests is worlds apart to what you have in general practice. So your ability to sit with risks changes as a GP, and that's advantageous in the digital health setting. But as well, because general practitioners interact with all areas, all disciplines within healthcare, all types of health service, it means we're really good representatives of healthcare and the NHS as a whole. So digital health companies are looking on how to get into the NHS. A GP is a really good navigator through that complex web that's NHS healthcare.
Absolutely. It's that link up service, isn't it? You're the coal face of many of the issues that these health tech firms are actually trying to provide solutions to. But then you're connected with that next step as well, with hospitals, people working within communities, etc. So again, I think that's a particularly interesting point to make with our demographic, who are looking to take that first foray into working within a health tech company, but wondering how the heck they're going to get there. So what motivated you to start looking at health tech options? Because you've worked in and around the industry for several years now, which I would say is like ahead of the curve, and certainly ahead of the trend. Yes, we're getting people asking us now, but we certainly weren't 5 years ago.
Yeah. Well, I certainly didn't know I wanted to get into health tech. That's for sure. I'd had these conversations with the careers advisors rather, and they'd kind of put me on the track of thinking about entrepreneurship. So I essentially I knew I wanted to be strategic. I like long-term planning. That just is the thing that really excites me. Kind of thinking long-term, thinking preventative, and there was a bit of that in general practice. But I thought healthcare leadership might be the way to get exposure to more of that. So that was my first deviation, I guess, from the normal route. I applied for a health leadership fellowship that was offered through Health Education Northwest. I went through the Elizabeth Garrett Anderson program, which is a study stream within the NHS Leadership Academy. And through that, I started developing my leadership skills. And I guess the difficulty as a trainee is even when you learn those skills, there's not always many opportunities to actually utilize them.
Yeah.
So my way to kind of exercise a bit of that, I guess, was through medical politics. So I started getting involved with the BMA and got onto doing work with their GP committee at the local level, then at the national level, and then at the kind of beyond GP training, the GP committee of the BMA. Mm-hmm. And there was a great route to kind of see healthcare through a wider management and political lens that I wouldn't have otherwise got through training. Yeah. And after doing all of that, the experience was amazing, but I came out knowing that I didn't want to be a medical politician. That path wasn't right for me either. Yeah. So I stepped back from that world and again started looking for other opportunities where I could be strategic, where I could plan, where I could forward think. And that led me to developing the mental health business you mentioned before.
Yeah. Yeah, absolutely.
So just to kind of explain a little bit about that, I've been thinking about mental health. My other half is a teacher, so together we were equally frustrated at CAM's waiting list. Predominantly, it was CAM's waiting list that was really, really winding us up, and we thought there's got to be a way we can support those children who have low-lying anxieties or low self-esteem, problems with low mood, but perhaps aren't at a point where they'd be clinically diagnosed with depression or anxiety. Can we intervene early? We thought the schools were the opportunity to do that. Now, knowing nothing about business really, but having all the, this leadership skill set, I wasn't really sure how to develop the idea beyond just an idea. Yeah. But that year was when the NHS launched the Clinical Entrepreneur Program. For those that haven't heard of it, that's a program for any clinician with an idea to improve healthcare, whether it's just as an idea phase or whether you've got a prototype or you've got investors. And it serves as both a supportive network, but also an educational program to teach you everything you need to know about, patenting, intellectual property, law, finance, investment, all of those kind of entrepreneurial skills you'll need in your toolkit. So that was a phenomenal opportunity and gave me the confidence really to launch that mental health business.
Yeah, absolutely. And, I think that, what motivates, a lot of clinicians that maybe want to make the step is that, they feel, GPs in particular, obviously, we're talking about GPs, is, the feeling that you're having, an effect on your list. So your list size and the patients that you see at your GP surgery versus, something that can, affect the wider population and, thousands and thousands of people. And that's really the kind of step up, isn't it? And what that kind of platform allows you to do, and obviously you found your way into health tech via that particular route. But I imagine back then it certainly wasn't easy to find ways into health tech, and how would you say that's changed now? What's it like now if you are a GP trying to pursue opportunities within health tech? How many opportunities are there for people that perhaps lack the experience and haven't experienced as many different environments as you?
Yeah, I think actually now there are more opportunities than there ever were before. But I think the challenge is that they're just not broadcast. They're just not advertised. Mm-hmm. People often think that to get exposure to digital health, you need to be appointed a medical advisor for a digital health company. And that's not always easy to do. You get stuck in that perpetual problem of, the job descriptions all saying looking for someone with 5 years experience. And you think, well, how does anyone ever get the 5-year experience if no one's going to accept someone with 0 experience? The fact is there are lots of other opportunities for GPs or clinicians wanting to get into this. So, for example, most ICS boards will have a digital health group or a clinical safety group. And they're always looking for clinicians to help support them with their work. So I'd reach out to them, and if nothing else, ask if you can attend some of their meetings, if not be part of the group.
Mm-hmm.
Also, most professional organizations will have a digital health group, sometimes called a clinical informatics group. That's kind of old school language for the same thing. An
Yeah.
example being the RCGP has a health informatics group. And again, all you need to do to be part of that group is to reach out, and they'll be able to link you up with it. So kind of having a look to see, I would say, look to see if there are any groups within your current sphere where you can get exposure to digital health. And that's a strong place to start. In
Yeah.
addition to that, there are a number of different conferences, often which have free NHS tickets, things like the NHS Confed or the HET Festival, which is later this month. If you're close to where the conference is being hosted, you can attend completely for free and then start building up your digital health network and getting up to speed on some of the new developments.
Yeah. Okay. No, that's great. That's really good practical advice as well that we can make a note of and provide in some form of note section, rather than just saying, yeah, go and call a bunch of health tech companies and see if they'll listen to you, which of course you can't. And to be honest, most of them don't actually have phone numbers that someone's going to pick up. So unless you're doing some of these proactive things and contacting the specific groups that you've mentioned, it isn't that accessible. And like you say, the roles aren't been, advertised. So I think it's very much about, people, getting involved and, a bit of promotion going on, from clinicians themselves.
And do you know what I'd add to that, Andrew, is that I'm meeting an increasing number of clinicians that are joining early stage digital health companies. And they're saying, I've joined this company to learn more about digital health, and they don't know what to do with me, and I don't know what I'm doing there. And there's this kind of, the company knows they need a doctor, the doctor knows they need the company, but neither really understands the relationship or what they should be doing with each other. So I'd say, as a starting point, don't necessarily seek out any kind of startup you can work with. If one's there, great. But otherwise, definitely just start building your foundation with the things that are around you. And that, I will probably say, one of the most valuable things then that you will bring to any digital health company you join further down the line is you can say, I've been part of these groups. I understand how digital health is commissioned and assessed in the NHS. I know who the key players are in this region, in this network. And that is invaluable for when you do start doing work with some of these companies.
Yeah, no, I think that point you made about, potentially someone going in, especially to a very early stage startup and not really knowing how it's going to work, is a very good point to make as well. So, I think if you are a clinician that's looking to make that move, it's making sure that that's been, well considered, and, there is a, strategic plan in terms of, how you're going to add value. But the other point that you made a bit earlier on as well was, it's not just about, going and accepting a medical director, role within a health tech company. Back in July, you had a really, fantastic blog about 6 reasons you'd be crazy not to have a clinician in your product team. So specifically within product. And in that, you describe your experience. You literally gave a bit of a blow-by-blow account about your first day and how you felt initially out of your depth. Why was that? I mean, again, it's probably because you're an early adopter, but was it because they didn't know how it was going to work? Why did you feel like that, do you think?
I think it's culture. It's a very different culture. I think firstly, working in a really creative space, a really innovative space, it's unlike anything you will get the opportunity to experience in the NHS, which, if you're a creative person, is wonderful.
Mm-hmm.
So just, complete, whiteboards, Post-its, color pens, no ideas too wacky, let's pop them all down. That, just being that open-minded was fantastic, without any of the closed-minded, we've done that or that won't work thinking you sometimes get in kind of established NHS organizations.
Mm-hmm.
You've also got the whole approach to iteration and innovation. So in health tech, there's a real focus on churning out small little things in order to test whether your assumptions are right or wrong. And then if your assumptions are right and you prove something, then you build on it and you test it again, and you build on it and you test it again. I think in the NHS, sometimes we are guilty of a little all or nothing thinking. Either we've got to plan the whole thing out and then deploy it in a kind of bulldozer approach, or we make a lot of assumptions without testing any of them, and we immediately go with the first idea that comes to us or comes to our manager sometimes. So definitely the focus on data and on just trialing lots of little prototypes and building gradually was a big culture shift for me.
Yeah, absolutely. And I was going to ask what are some of the biggest differences that clinicians face transitioning from NHS into a health tech company. But it's when you mention something like that, I think it's a really good point. And presumably when you've got a clinician like you working within health tech and seeing some of the things that are positives and work really well, is there an opportunity to take that back to an institution like the NHS and change it, or is it just too big? Can that ever happen?
Well, it definitely. I think this is why the entrepreneur program was set up, the clinical entrepreneur program. It wasn't just to kind of siphon off good doctors and nurses to go and work in industry. The idea was that those clinicians can also function bilaterally and bring those things back into the NHS. So I think it definitely works in digital health. Mm-hmm. For me personally, probably one of the biggest take homes I've taken away, and this is I suppose a product mantra, is to always make sure you have the right problem. So always start with the problem. Don't run off and instantly try and come up with solutions. Always take time to fully understand the problem. And just that little tidbit, I've managed to reap some benefit from applying it to projects in my practice. So by all means, I think trying to bring some of that culture into healthcare, into general practice, would be really beneficial.
Yeah, no, I like that one. I'll nick that. Start with the right problem. So starting with the end in mind, essentially, and then lots of testing. So, based on that and based on your experience and based on the fact that clinicians shouldn't just be pigeonholed into certain kind of roles within health tech companies, what do you think are the so if we're talking now directly to owners of startup companies, seed stage, Series A, why should they be employing clinician to work alongside some of the the things that they're doing early on in the company's development?
Sure. So this is my sales pitch on behalf of the profession to industry. Yeah. I think there are four major areas to where doctors, clinicians can really help digital health beyond just the product. And like you mentioned, I have done a separate blog just looking at the product side of things.
Yeah.
I would say the first one, let's start with products. So the first one is that clinicians bring an inherent understanding of how the system works. We bring an empathy for how patients think and feel. We spend our careers advocating on behalf of patients and understanding, especially in general practice, not just how they experience their illness, but how their illness ends up shaping all elements of their life and the decisions they make. So I think that's really important. Mm-hmm. Also, our ability to assess risk is a big value sell, I guess, for industry. There are roles that some of your audience might be aware of. Clinical safety officer, that's a trained role that can only be held by a registered clinician. And that role is necessary for any digital health company to meet the requirements of NHS digital standards on safety and health tech. So I think that's definitely one role. Put a clinician or a doctor as your clinical safety officer and get them telling you what patients experience, how they navigate the health system. Obviously get patient input too. That's best. That's kind of gold standard. Mm-hmm. But also use your clinician to help you understand healthcare. Yeah. I think the second one is clinicians bring a great understanding of what good clinical governance looks like and how things should work operationally in healthcare. So if you're running a digital health company that's got a strong service delivery element to it, perhaps you're running some testing facilities within your organization for remote blood tests or remote swabs. Perhaps you're delivering a video consultation or service or an online pharmacy. You're going to have to design care pathways. And as soon as you start delivering care, being provider of care, you'll fall under the auspices of CQC, and you'll need to provide training and do audits and quality improvement and all of that stuff, which to a digital health company is overwhelming.
Yeah.
So putting a clinician in place, especially a GP who's been through CQC inspection,
Yes.
is really valuable for making sure that from a governance and quality perspective, your company's up to scratch.
Yeah, absolutely. And I think, even with the planning that goes into, a product or a particular service that's been, that someone is bringing to fruition, we still see examples of where it gets to that part, and you need to be compliant, legally, and from a healthcare perspective, and people aren't, or like, suddenly, we don't know what we need to do. We need some advice here. So I think having that earlier on, and it, also shaping the product and the journey is a beneficial thing. So not just last minute, right? Okay, how do we get this signed off? But actually involving the clinician earlier on, in terms of how it's going to shape the the latter product or service that someone's providing. So yeah, some really good points there.
A total blocker. I think the last two roles I would just add very quickly to the end of that, Andrew, is I would say if you're a GP or a clinician with research experience, that's highly valuable at the moment to digital health companies. There is, I think now that the market's getting more savvy around digital health, there is a constant requirement to see good randomized controlled trials, pilot studies, and a lot of digital health companies don't know where to start with that, or at least don't have relationships with hospital trusts or practices where they can actually pilot their tech. And then the fourth and final area is the network. So health tech companies are always going to try and be leveraging any relationships they can with senior decision makers across the NHS. And as a GP or other doctor that's been working in this space for years and years, you will have a network that carries huge amounts of value, even if it's just a network that allows you to facilitate conversations with the Royal College or with your Chief Information Officer or perhaps your PCN clinical director. Those are really valuable relationships, and companies will benefit a lot from those.
Yeah, absolutely. That's another great practical point that people have. That's something that they don't have to kind of actually train for or gain knowledge. It's something that they will have, obviously working with the NHS. So I think that's a really good point, because it's relevant to most of the people that are going to be listening to this. So that's really good. What do you think the future holds then for clinicians within health tech? We've mentioned a variety of the different roles that they perhaps can get involved in, but where do you where do you see it it going, particularly for GPs?
I think we'll see more opportunities crop up. In the 5 years I've been working in digital health, I've seen many more roles develop, many more committees set up, interest groups set up. So I think you're only going to see more and more opportunities. I think as well, over the next few years, what we'll see is some formalization of the education, both for frontline GPs that perhaps just want to be aware of what's out there in digital health, right the way through to clinicians that really want to develop this almost like a subspecialty. The Faculty of Clinical Informatics, the FCI, is trying to develop they have developed a framework, a competency framework for digital health clinicians. And they're trying to, develop some traction and force behind that. So you can already see that that's the direction of travel this is going in. But certainly, I think we'll find that whether you're really passionate about digital health or just have a passing interest, we'll all start needing to know how it works to utilize it in our day-to-day practice.
Yeah, no, that's great. That's I appreciate that insight. And Before we finish, I just had like a couple of specific questions, I suppose, about you and your current role, Tom, because we've discussed some early parts of your career, but now you work for Orcha. So, I mean, most people will know what that is. Certainly within our audience, but it's a tech that reviews and certifies digital health technologies, essentially, and that's not just here in the UK. That's across the world. And you are a clinical director there. So what does your role now involve? What's what are you doing on a day-to-day basis?
So we've got a clinical team of about 15 or 16 clinicians at the moment at Orcha, representing a breadth of professions and specialties. And the bulk of their work is focused around clinically assessing new health apps that are entering the market. So most of my role is making sure they're inducted, trained, supervised, managed, and able to carry out that role. But as well, Orcha's kind of got this product, this assessment service that they're rolling out, but as well, they're a very mission-driven company, and they're really driven by the desire to increase the use of safe and effective health tech by clinicians and patients. So a lot of my role is trying to manage several strategic projects that can facilitate that. So we've launched the Digital Health Academy, which is completely free to NHS professionals, by the way. So any of your audience there, if you go to the NHS e-learning hub and type in Orcha, you can access those modules there. That's all about educating the workforce in digital health so they're confident recommending it to patients. We're also building out a network, a kind of informal professional network of clinicians that are interested in digital health and can help join us on that mission. But over the next few months, you'll be seeing other projects get developed, all with the aim of trying to drive up adoption of digital health. So it's as comfortable to a GP recommending an app for calorie counting, weight management, smoking cessation, as it is prescribing amoxicillin for a chest infection.
Yeah, absolutely. And I think, Orcha was ahead of the curve. Orcha was not set up to, address many of the issues that we've seen because of the pandemic, where you have, thousands of, mental health apps, for example, that just, aren't being monitored, for their efficacy or anything like that someone might access and, obviously not get the results that they're looking for. So certainly ahead of the curve in that sense. And I think that's maybe something that's influenced uptake within general practice in terms of clinicians' confidence to prescribe digital products to their patients. Because one thing that we've seen recently, we're in the midst on the GP side of things of doing a working conditions and salary survey. But one of the findings that we are seeing from that is actually, whilst there were differences we recorded during the pandemic in terms of working practices and people adopting new technologies, as we're coming out of that now, we seem to have reverted to a lot of what we were doing previously. So for GPs, that's face-to-face appointments. It's video consultations dropping again. It's the use of the telephone. It's people not using apps and that type of thing as well. So there's definitely it's not like the pandemic changed primary care, is it? Or the work of clinicians. There's still a lot that needs to be done to adopt these new technologies and increase confidence.
Yeah, there certainly is. I think as a GP, I've seen my own behaviour revert to pre-pandemic, and I think it's because the workload pressures are so immense. We will just revert to the easiest thing, which is the status quo at the moment. I think video consultations were a little disappointing in that they, patients didn't necessarily like them. Sometimes it's a bit clunky in, getting a video feed that's good enough quality, and they can take more time than we've got. I think but we mustn't throw the baby out with the bathwater. I think we just need to really reiterate the message that there is health tech out there that can save time, that can reduce the dependency patients sometimes have on the health service. And that's kind of the message Orcha really wants to get out. There is good health tech. It is overwhelming because of tens of thousands out there. How are you supposed to know? But don't just shut the door on the whole lot. Let us help you to identify the best apps that can help you and help your patients.
Yeah.
Then I think if we can achieve that, we'll start seeing the shifts that the pandemic didn't quite manage to maintain.
Yeah, absolutely. And let's not forget, clinicians were under, tremendous, not just pressure from patients, but political pressure to revert to type and see face-to-face appointments. So it's perhaps not surprising, that we've seen that return to, what we were doing beforehand. But like you say, there are still tools that and I think again within general practice, primary care for GPs and clinicians working in that environment, there's huge potential for that link up again. So for wearables, for at home testing kits, whether that's for it could be you see DNA, cholesterol, blood, vitamin, all of these things that will hopefully allow patients to monitor a condition at home. Maybe wearing a wearable device that then links up to their GP surgery that their GP can keep an eye on. So hopefully we see those kind of trends and just the tech and the apps working in harmony with general practice. So we are being more preventative rather than reactive, and we are freeing up time for clinicians to focus on the patients that need it. But yeah, seems like there's a long way to go at the moment, Tom. But there's definitely kind of good signs, hopefully, isn't there?
There is, and I think let's not be too negative. I think following the pandemic, I'm still delighted when I have a phone call from a patient who is unwell and they tell me over telephone their blood pressure from the blood pressure machine they bought during the pandemic, their O2 saturations from the SATS monitor they were given by the district nurse during the pandemic, the thermometer, the temperature from the thermometer they bought. When they're able to reel off their observations like that, and it makes the clinical decision making so much easier, you think actually there has been a shift here. Patients are more accountable. They're more used to taking control over elements of their health. And we mustn't forget that. In fact, I think we need to really hold on to that when we're thinking about embracing the tech of the future.
Yeah, absolutely. I think that's a perfect example because my father-in-law had a heart attack during the pandemic, and he was able to remotely send his data to the specialists that he was dealing with. And then, through rehab, he's been able to do video consultations and online led exercise classes for strengthening heart and things like that. So there are really good examples that do exist and that are working. But I think the one that you gave is perfect. Just being able to monitor that, have an effective conversation. That person then isn't coming in to see you in practice. You've got that. You can make the notes. You move on. The clinician then sees them all. The person that needs seeing, which is great. So, are there any kind of particular products or areas of health tech that are exciting you at present, or that are of particular interest?
Yeah, I think there are a number of different health technologies that are really exciting me at the moment. I think the wearable market will be a really interesting one to watch. I think up until now, the main developers of wearables have really focused on this data game. Let's just collect more and more data, and that's what the customers want. And whichever device collects the most data is the one that wins the race. And that strategy has kind of been winning up until now. When you look at the feature set of each of the wearables, there are brand new features, but no real clarity on how the patient's supposed to use them. An example being that there was this huge rush to give everyone O2 saturations monitoring on their wearable devices. Well, actually, then they really struggled to find a use case for why that was useful. And now they're having to go back retrospectively and think, oh, crumbs, what can we use that for? So they're starting to learn that data without insight isn't useful to use as a tool. So I think as we start seeing a move from just data collection to insights and behavioral change, I think that could be really powerful for healthcare. So that's number one. And the second one that I'm really interested in is the remote monitoring and remote diagnostics. I'm not sure if you saw in the news or your audience saw in the news recently in the BBC, but the Dyson Award was given to a device with an accompanying app that allows women to screen themselves at home for breast cancer and to examine their breasts much better. That kind of tech could be game changing.
Yeah,
There are
absolutely.
already apps out there that can, reportedly test for heart arrhythmias. There are apps out there like Novaware that can help with spirometry at home. So we're just seeing increasingly more of those tests being put into the hands of patients, and with the right guidance, I think that's a really, really good thing for preventative healthcare.
Yeah, absolutely. No, we did have that on our news feed, and literally someone did describe it as a game changer, which it certainly is. And yeah, the type of tech that's going to have really useful preventative, hopefully, or at least early stage detection of diseases like breast cancer, of course. Yeah, certainly, wearables is definitely something that interests me as well. And like I say, certain well-known, big brands have, had certain, features, like you say, monitoring, oxygen levels within blood, and people are like, so what? But yeah, it's interesting to see that, some of the changes, coming in, like actually, monitoring sleep. Because for me, it's in terms of people's overall health, or its physical, mental, etc. That is also a
Yeah.
game changer, and I've seen that come into the wearables space in a big way. Both in terms of obviously watches, but also some interesting stuff around dream analysis. And stuff that just sounds like insanely futuristic. So yeah, good to understand your thoughts and some really good examples there. So, moving on from that, what's next for for you? Are there any other kind of projects or goals that you're focusing on present, short term, medium term? I'm sure there are lots, of course.
Short and medium term, my focus is going to be on the Digital Health Academy at Orcha, so trying to upskill the workforce so they feel confident recommending the right digital tools to their patients, and about building this professional network that just doesn't exist for clinicians that have an interest in digital health and promoting its use at the front line.
Mhm.
I think long term, what I would love to do, and I know the founders of Orca share this vision, is I would love us one day to do work in the developing world around health tech as well, because
Mhm.
I think actually the UK is extremely forward thinking in terms of digital health. We're finding that the more international work we do, we really are pioneers in this space. But being able to take those learnings to other countries, especially countries with lower incomes, where
Mhm.
the journey from home to clinic is that much further, where
Yeah.
access is that much more restricted. I think digital health could help, not just improve but save many more lives.
Mm-hmm. Absolutely, yeah. Rural health companies. There's some frightening stats about yeah, not just the access, but the impact that has on things like expected living ages, etc. And with there still being a worldwide shortage of clinicians, to be honest, it seems like it's the only way that we're going to be able to address those kind of issues. So yeah, again, a really good point. And yeah, thanks for today, because I think the really good thing about what I've seen from your content and the stuff you do, it's not just about providing sound bites. It's there's some good practical advice in there. There's actually steps that people can pick out. And adapt to what they're doing. So it's been a pleasure chatting with you, but I'm sure that our listeners will massively, value the advice that you've given us today, and hopefully be able to use that themselves, and yeah, start getting into to health tech. So thank you very
Well,
much.
thank you very much for having me on, Andrew. It's
Oh,
been a pleasure to be a help.
no, you're very welcome, and hopefully speak to you again soon.
Speak
Cheers,
soon.
Tom. See you
Bye.
later. Bye.